There is a history of in the healthcare system experimenting needlessly on black bodies. So when you invite black people to a trial, if all they will see is it's another experiment, another opportunity to experiment on a black body. My name is Brian Quavar, and I consider myself, I say to everyone, I am a prostate cancer survivor. I was diagnosed and treated in 2021. I am now clear of prostate cancer, and I hope it continues that way.
So do we. My name's Oliver Kemp. I'm CEO of Prostate Cancer Research and been CEO for the last 6 years. How would you see the world being different if 1 in 4 white men got prostate cancer instead of 1 in 8?
One, there would already be a national screening program. The research will be more advanced because if you flip the script and it was white men being twice as likely to be diagnosed with prostate cancer, then there would definitely be research as to why that is. And it's been known for over 20, 30 years that black men are more predisposed to getting prostate cancer. And yet still, nobody knows. Until that research that was published last week in the Guardian, until then, that is probably the closest thing to gaining that understanding as to why black men or people of African descent are more predisposed to getting prostate cancer.
Brian, you're involved in a whole bunch of local groups, and there's a WhatsApp group that you're part of. Do you think that I suppose, understanding that there is this discrepancy is something that's understood by the majority of black men? Is it things that are talked about within your local group? Yeah,
it is. It is spoken about. And the other thing is that it's also spoken about is the fact that even with those people who are aware of the risk and present themselves to be tested, they're turned away. And they're turned away by GPs when, even though, as I said, they may be at high risk, they black male over the age of 45 with a history of prostate cancer in their family. And they go to the GP and ask, can I have a PSA test? And the question is, why? Do you have any symptoms? No, you don't have any symptoms. But we all know that prostate cancer you can have prostate cancer without having symptoms. And is it that those GPs are not aware of that? Or is it that they're waiting on the cancer? If it is that the person has cancer, they're waiting until when the person shows symptoms, which may be too late, then to send them for treatment. And that is why the death rate amongst black men is so much higher.
And I suppose, given the fact that it's 1 in 4 for black men and 1 in 8 for white men, would your argument be that should be an immediate PSA test at that point when a black man goes in front of a doctor and says, I'd like to have a PSA test?
Yeah, the conversation should be, are you aware of the fact that a PSA test is not 100% foolproof? You can have false negative, false positive. So having a high PSA does not mean that you have prostate cancer. So once a person acknowledges that, once a patient acknowledges that and understands that, yes, there should be no hesitation.
Yeah.
Right? It's a blood test. And the previous argument was the reason why they don't give everybody a PSA test, or why there isn't a national screening program, is because they don't want to overtreat, which is nonsense, to be honest. Because you don't start treatment after a high PSA.
Can I ask you follow up on that question about overtreatment? Because I think it's a really interesting question associated with racism. And I suppose the question I would have is, given that black men are being turned away because the authorities, the powers that be, see the risk of overtreatment. The risk of overtreatment, I suppose, is only there if there's a belief that the patient in front of them can't make an informed and empowered decision based on the potential risks on either side. The risk of being incontinent and impotent for a significant period of time because they've decided to opt for treatment now. Now, if everybody was made fully aware of the risks on both sides, obviously the cancer growing on one side, the risks of the side effects on the other side, do you think that would be the case if it was a white man in front of them and they said, I understand all of the issues, I understand all the information, and I still want to opt for treatment?
First, to begin with, as I said, after a high PSA reading, treatment doesn't start. So that bit of over-treatment, treatment doesn't start yet. More investigation is required. You do a digital rectal examination, CT scan, MRI scan, biopsy. Until prostate cancer is confirmed, then you have the treatment options being presented to you. And once the treatment options are offered, and it shouldn't matter to who is in front of the doctor, you can't presume ignorance because of the person's race. And if the person says that they understand clearly what the options are, or if because of emotional issue they may not be focused on making an informed decision, then maybe you suggest to them, come back again, or come back with a friend or relative who then you can talk to the people in front of you now and give the treatment options and present the side effects of the treatments, the various types of treatment. And then that should be across the board. It shouldn't depend on where you live.
Yeah.
Because if you're a younger man, let's say you're age 45, 50, and you may still want to have children, then the option to preserve your sperm should also be given. That's not always. I've spoken to a lot of men. They didn't know that they had that option. Right? When I was given the option to have a prostatectomy, I knew I didn't want to have children. I made that decision 20 years before because I had a vasectomy. So having a prostatectomy and not being able to produce sperm wasn't an issue for me.
Yeah.
Right? What was an issue for me is preserving some level of sexual function. Right? And I understood the risk and it depended on how much nerve spare there was. I understood that. I understood that there were also other things that can be done to help me regain some level of sexual function. And these are the conversations that should be presented or should be had with the patient, and regardless, and it should, as I said, it should be across the board, regardless of race.
And do you think that lack of information, that lack of conversation, given the increased risk to black men, is just bias ingrained within the system?
It's probably, I can't say definitely that it is bias. All I can say is a conversation. It's probably cultural ignorance rather than bias, because not understanding the things that are important to different cultures. Because one of the things that a lot of black men have issues with is anything that interferes with their sexual function. Right away, that raises a barrier. But if they clearly understand the risk involved for not having any type of treatment, and the effect it could have not only on them but on their loved ones, I think they would opt for the treatment.
Mm-hmm. Do you feel as though that undermines trust in general? Is there a lack of trust with the system because of cases like that, where those things haven't been discussed and men end up having side effects that have never been talked about?
Yeah, that if that level of trust isn't gained, then stories, if another person hears stories like that, they're not going to offer any kind of treatment. The type of treatment and the options of treatment, as I will reiterate, should be the same no matter where in the country you live.
Yeah. One of the concerns we have, obviously, we're a research organisation, the majority of our charitable expenditures on research. And one of the difficulties we have is because of the lack of trust, it means that there's less black data in the system, which means that there's less data that you can do the analysis on, which means less treatments and diagnostics that are able to focus on black men. So we get this vicious cycle: lack of trust, lack of data, lack of treatments leading to greater lack of trust, and round it goes. How have you got any advice to us to try and break down some of that barrier and get more black men involved in healthcare of themselves and of future generations of black men, their sons, etc.?
First thing would be to have more people who are having these conversations with these black men looking like them. Because there is a history of the healthcare system experimenting needlessly on black bodies. So when you invite black people to a trial, or if all they will see is it's another experiment, another opportunity to experiment on a black body. If the clinicians and people involved in the research, if there are more black people inviting these black patients to this trial, to any type of conversation, trial, or anything like that, if they see themselves, there would be more trust in the system, because they will have more faith that a person looking like them, inviting them to do this, they're not going to lead them down or experiment on them, yeah, or lead them into something that's not going to be helpful. So that's where your starting point should be. having more Black clinicians involved in research, having more Black doctors, nurses, inviting these Black people, having conversations with these Black patients, and to explain to them the reasons behind what is being done and how it could benefit them. When it comes to how to encouraging more Black men to present themselves for tests, one of the things that I say to men who are hesitant about having a PSA test, because some people say what they don't know can't hurt them. I say to them, what you know empowers you. It could help you, it could help your children, because as a Black man or a Black person with prostate cancer, if you're diagnosed with prostate cancer, it means that your sons are at risk of having prostate cancer and your daughters are at risk of getting breast cancer. So having that knowledge, whether you want to treat it or not afterwards, but at least have the test so that it empowers your lineage. So they know, because a lot of men only find out that their dad had prostate cancer when they are diagnosed with that prostate cancer. They never knew they were at risk. So now if this upcoming generation, if more Black men present themselves to be tested, and at least they have the knowledge that yes, there is prostate cancer in their system, then if they choose to delay treatment or whatever they choose to do, but at least their children will have that knowledge.
Yeah, definitely. And I think one of the things we've talked about previously is that motivation, and knowing that you can look after your children seems to be a very powerful message that could be delivered. Mm-hmm. Do you think there's a message as well around, I guess, a community message, that it's not, sure, I completely get the kind of, this is important for your children too, but is there a message around, this is also important for making sure that your friends have got treatments and diagnostics developed for them, for the wider community to have new treatments and diagnostics? A philanthropic message around the Black community, I suppose.
Yeah, and definitely, because one, prolonging life will be beneficial to the community as a whole. So having more older men being part of the community and not just falling by the wayside or dying by the way because of lack of treatment, lack of or ignorance, it will benefit the community. It will also benefit the community in terms of, if more Black people are involved in trials, there would be more advancement in having treatments as well as diagnosis. It could be earlier diagnosis.
Just that it comes later on in life, like it's just another
barrier. It's just another incident of racism when they're not offered early treatment or early testing, especially when they have that awareness and they present themselves. And if they don't have the awareness to challenge the GP, if the GP says no, if they don't have that knowledge, then they'll just walk away. And they could be walking around with prostate cancer. One of the men in the group, one of the groups that I'm in, he was diagnosed with prostate cancer, stage 4 prostate cancer at age 40. And 18 months before, his PSA came back negative. So the question here is it that he got a false negative, or was the cancer so much more aggressive in him to go from nothing to stage 4 in the space of 18 months? And again, this is where the research should be looking at.
Yeah.
I don't know how much data is gathered from the Black patients around the country to see, like, for example, those who are being monitored to see how their cancer is progressing over the years. I don't know how much of that data is gathered and how it will be used. Would it be used to screen people more regularly or earlier in their life?
Mm.
So this is where the research needs to be going.
Yeah, and I think it's worth saying that the largest project that we've ever launched is currently looking particularly at those issues. So we're designing a platform which will be able to spot those variations and be able to track how Black men's cancer and other variations that exist is progressing over time, literally in real time as well. You'll be able to say, okay, well, what is happening as somebody is going through diagnostics and treatments, and how is that cancer progressing? Mm. That's a very significant project, I'm sure, as you can imagine, because you're going to need tens of thousands of people's worth of data to be able to push and influence the powers that be in order to do things about it. And I think one of the questions that we're going to have when we get to that point is what would we say when we've got the data to prove that screening is absolutely vital, that bringing forward testing for Black men is absolutely vital, and that we can do it economically viably because you've got such high rates of Black men getting prostate cancer. If you were in the room with the health secretary or the chancellor, what would you say to them to make them make that decision to spend their money wisely?
I would question what value are they putting on a Black life. What does a Black life? What's the value of a Black life to them and to the economy as a whole? Because losing people needlessly when they could be diagnosed early, treated early, and their lives could be prolonged. What is the economic value? And if they see any economic value in it, right? Or are they still in that colonial mentality that Black lives are not valued, or Black people are not valued? And this is a conversation. It's a tough question to ask, but it's important in that people need to feel valued. It's been too long in coming to the point where to the understanding as to why more Black men are being diagnosed with prostate cancer. There are people who feel that because they're Black people who feel because they live in Western society, that is why they've been diagnosed with prostate cancer. They feel that if they were living in their countries of origin, it wouldn't be like this. But of course, that is a misunderstanding, because prostate cancer is rife on the African continent and in the Caribbean. And it may be because of lack of resources for that early diagnosis and early treatment, why it is so it is such a bad state. So that holistically, that is how it needs to be looked at, and in getting the powers that be to pay more attention and to put more money into getting this problem sorted out in the Black community. Those are the questions that need to be considered.
Putting economics to one side, I think these decisions are often made for economic reasons. But putting economics to one side, would you argue there's a justice angle here as well? I suppose there's, black men have often faced racism for their entire lives. There's been Windrush, there's been Stephen Lawrence, there needs to be a focus on making sure that there's greater trust, and this would be one way in showing that actually this country does care about its entire population.
Yeah, that would be a good argument to make. So that if you're looking after the senior black men or black population and you're looking out for them, then maybe the general black population will think, okay, things are moving in the right direction when it's coming to the country seriously considering their right in society. So yeah, it probably would make a difference.
There's a question that we've been considering about a project that we would like to launch around trust building. And I mean, one of the things that we pick up a lot is that clinical trials, that word trials is not always the best word to use, but clinical trials aren't as accessible or aren't accessed as much by black men as by white men. And one of the reasons for that is that often people come into an area and say, well, actually, there's this new clinical trial, the window is now open for a year, and can you sign up to it? There's been no trust building leading up to that point. Signing up to be part of a trial, a guinea pig, which is often referred to, is often a big thing. It's a big thing. It's a big decision to make. There's lots of barriers and hurdles to cross, lots of paperwork to fill in, all those types of things. Do you think it would be beneficial for an organisation like us to try and ensure that there was greater trust before coming in and saying, now we'd like you to sign up, give over your data, give over your samples, and be a part of this new thing?
One of the things I think is a challenge to getting people to be part of a trial is that you're invited to be part of a research project, whether it's a clinical trial or just data research. And you're invited in and you hear nothing about it afterwards. There's no follow-up. So you don't know what became of your involvement. Where did it lead to? How did it benefit the population? So if you have that conversation and let people know that they will be part of the project from the beginning to the end, that would help.
Yeah.
What will also help, again, I will always reiterate, is knowing that there are people looking like them who are part of the research team. So they don't feel like a lab rat.
Yeah. And that who's delivering the message is important, not just from who's part of the trial team, but I guess it's important for kind of if there's a message being delivered across a community, like if it's a kind of a church group or a social club or a person who's part of your WhatsApp group. Those things must also be important. It's coming from somebody that you trust.
Yeah, coming from people within the community, because in every community there are doctors, there are nurses, and other clinicians that look like us. So getting these people to be involved and saying that, getting an understanding of what the trial is about, what the research is about, so that when they communicate with the groups, whether it's at church, whether it's in the barber shop, whether it's at the, wherever it is, then they could say, yes, this is a worthwhile, this trial, this research is worthwhile to the community. And we encourage people to get involved. rather than just it being an email, and then it just, when you read it through, you think, well, where is this going to lead to? So maybe having focus groups leading up to it.
Yeah. I have one final question. My final question is really around, I suppose, why do you get involved? Why get involved with an organisation like us? You must have hope that things will change for the better. Is that true?
My thing is, I will speak with anyone who I think would help push things forward, and in a way that would benefit my community. I don't want to affiliate myself with any one organization, one project. I speak wherever. When I was diagnosed with prostate cancer in, I think it was 2020, I was fortunate. I was diagnosed and treated during the pandemic. I consider myself fortunate. I was diagnosed and treated within 2 months. And since then, I have been speaking out and encouraging other men, especially black men, to present themselves for testing. And the other thing I observe on my journey is the lack of representation within organizations like yourself, like Prostate Cancer UK. I went to my first prostate cancer, March for Prostate Cancer, after the first one that happened after my diagnosis and treatment. And what struck me is the lack of black people in this space, whether as volunteers or even participants. And there is this old adage that when organizations want to reach out to black people, they say that we are unreachable. We are not unreachable. It's just that we do things differently. So if you want to reach us, then you can't come with your white male lens and think that we just have to, this is the way you do it, so this is the way everybody needs to do it. Right?
I completely agree with that.
So it has to, if you want to reach the black community, you have to come into spaces, to our spaces, have open and honest conversations with us, have people involved in your project that look like us. And then we would listen. Then we would feel that we could participate. When there are conversations about prostate cancer in the mainstream media, it's mostly white men. Black men don't see themselves, so they don't feel that message is for them. So if the messenger doesn't look like them, then the message is not for them. Mm-hmm. That's the thinking. For example, during the early stages of COVID, most of the deaths that were being televised and being spoken about were white people. They go in the hospitals, all you saw was white patients. So black people thought, well, that's not affecting us. That's a them problem. Only to find out that actually we were being more affected by COVID than any other people in the population.
Yeah.
But we weren't being shown.
Yeah, and I think one of the things that you advised me to read, so the first 20 people who died from COVID as clinicians, as healthcare professionals, were all black or Asian.
Yeah, because they were thrust into the front line. You deal with that. Everybody else, decided, well, I don't want to be close to this. So they went away, they did whatever. But black clinicians, they were upfront and personal. the carers are mostly from the black population. So they were hands-on, but the proper PPE wasn't provided.
Can I ask another question that's just come to mind? I did say that was my last question. It wasn't. I suppose we have an opportunity to try and bring in some black celebrities, and I think older black men I'm thinking of. What message would you give to them to say, we need you to come forward and speak out, because actually your voice would make a big difference?
First, I wouldn't only look at older black men. I'd be looking at men in their 40s and upwards. Because prostate cancer is seen as an older man's problem. But then when you have men in their 40s and 50s who are being diagnosed with prostate cancer, a 50-year-old man doesn't think he's old.
Yeah. I'm getting that way myself.
So it shouldn't only come from men who are already diagnosed or who have a higher potential of being diagnosed. It should come from where you want the screening to start. Screening ages at the moment is 45, men 45 and over. And you say to those people, you have an opportunity to help save your community, to help raise awareness within your community about this thing that is affecting you twice as much as any other people in the population. The challenge is not many men would come forward and say, I have prostate cancer, and then speak about the issues, the side effects of it. Not many men will come out and say, well, I've been, since my diagnosis, I went a year of being incontinent, or a year of being sexually impotent. Not many men will come forward, and especially black men will come forward, because there's this persona that is given to black men, as that we are sexually virile. So we cannot be seen as sexually lacking. So they're not that is what needs to be considered. Mm. It is a very sensitive subject within the black community.
Yeah.
So for a celebrity to come out and say, I've been diagnosed with prostate cancer, you don't necessarily want that. What you want is for a celebrity to say, I am in that age bracket of risk, high risk, and I am putting myself forward for regular testing, because you want people to come forward to be tested. You don't want to be preaching to the people who are already diagnosed. So you don't want that representation. You don't want representation from people who are diagnosed. You want representation from people who have the risk of being diagnosed with prostate cancer. And they're the ones who would encourage people to present themselves forward for screening. And then also implore on the GPs, don't turn us away. A PSA test is what, £20? If someone comes forward and asks, can I have a PSA test, please? Do you the response should be, do you understand that a positive or negative PSA test is not, you can have false positive or you can have false negative. A positive PSA test does not mean you have prostate cancer.
Yeah.
And once they understand that, do the test.
Yeah.
Just do the test.
It needs to be a completely different reaction.
Yeah. But again, is it economics? Because if you have a flood of people coming forward and for PSA tests, and let's say you have, in every 100, you have 50% of them having high PSA readings, then you're talking about more testing to be done. You're talking about X amount of people presenting to possibly have CT scans, MRI scans.
Yeah.
So is it more economically viable to maintain the status quo?
Yeah. Well, those clinicians aren't paying for it. It's the government that's paying for it.
Yes. So maybe that's where the message is coming from. Maybe that's where the message is coming from. Maybe those clinicians would like to do the PSA test, but the message to them is that your first response should be no. But if they insist, then you do it. If they turn and walk away, good, you saved us possibly a couple 100,000.
Yeah, I mean, to be honest, that is where the message is coming from, because that's the NICE guidelines currently. Unless you've got symptoms, you can't get a test.
But we all know by the time you actually present with symptoms, you already have prostate cancer, and probably a high stage of prostate cancer. You could be walking around normal. I didn't have any back pains. I put my getting up to wheel during the night, I put it down to you drink water, because I didn't have a cut-off time to stop drinking. I drank water up until I went to bed. And if I get up to go to the toilet, I have a bottle of water next to me, I drink. So it's more than likely within the hour I'll probably get up again to pee. So I put it down to that.
Yeah.
I didn't have that urgency to go to the toilet. Those are the symptoms they talk about. I didn't have all that.
Yeah.
But I had prostate cancer.
Yes, and we all know the PSA is fallible.
Yeah. So do it, and then if you get a positive, repeat it. Right? So you rule out false positive. Another message that isn't told to a lot of men when they come for PSA tests: no sexual activity at least 48 hours before. Not many men know about that. No physical strenuous exercise before presenting for PSA tests, because that can give you false high reading. So once those things have been ruled out and you have a high PSA reading, then repeat it. If it's still high, you do the next steps of that to positively diagnose it. DRE, digital rectal examination, CT scan, MRI scan, biopsy, and then offer treatment options.
Yeah, and once you run all of those, then you're going to get a lot more accuracy than a single PSA test. Because
you don't treat off of PSA. You do not treat. There's no hospital in this country is going to start treating you based on a high PSA reading. So that is a misnomer.
Yeah, I'd be very scared if they did.
Exactly. Regardless of what race you are, if you have a PSA of 100, they're not going to tell you, well, come in, we're going to take your prostate out. It doesn't work that way.